So good afternoon, everyone. My name is Mārtiņš Vargulis. I am Director at Analytics and Advisory Group Powerhouse Latvia, as well as lecturer at the Riga Stradiņš University. And I'm today accompanied with the distinguished policymakers, experts, members of the board, international experts. And we have one important task to do, colleagues. We have to answer to the question, how resilient is our healthcare system in era of geopolitical uncertainty? I would say that after 2014, and especially after 2022, resilience became as a buzzword in academia, within the context of discussions among international experts, security experts, but not only about the security. Resilience was everything, everywhere, and about everything, right? And what we witnessed, and especially taking into account the success, I would say, from the experience of Ukraine, resilience is definitely the center of gravity in the geopolitical circumstances that we are living. But when it comes to the resilience, it's not about purely military means. It's not about just military tools, army, weaponry. It's more about that, how resilient, how ready, how prepared the society and each of us individually we feel and we act in the times of crisis. And take into account that health is one of the biggest pie of each of the government expenditure, it's obvious that health has also or has to contribute to the overall resilience when it comes to the comprehensive state system. And in order to discuss that, we have, as I said, distinguished panel. I will shortly introduce all of them. First of all, Agnese Vaļuliene, who is State Secretary at the Ministry of Health of Latvia. Birute Kleine, Defense Counselor on Medical Support Issues at the Ministry of Defense of Latvia. Then we have Lauris Vidzis, Chairman of the Board at Pauls Stradiņš Clinical University Hospital. And Vladislava Marane, Director of the Association of International Research-Based Pharmaceuticals Manufacturers.
Hello.
And joining from abroad, from Globsec researcher, author also of the Health Readiness Index 2024, Martin Smatana.
Hello.
And Martin, if I may, we would like to start with you because you have done quite heavy work when it comes to the resilience. When it comes to the health resilience, you have prepared Health Resilience Index and also analyzed the situation of Latvia within comparison to other regional countries. So we would like to give you introductory remarks, what you found out, what is missing when it comes to the Latvia, and what are the main lessons learned for us that could give us some elements for further discussion today.
Perfect. Thank you very much. So yes, I've prepared a very brief presentation because the full-length presentation has more than 200 slides. We would need like 8 hours to go through all the details, and often the devil is in the details, but I will try to go through the most important bits and pieces that we found out about Latvia. But before that, just a couple of words about actually who we are and why we do it. So I'm here today on behalf of Globsec. Globsec is a think tank which originally started in Slovakia, then expanded into the world, ranging from Ukraine up to Washington. And we have been focused on enhancing security and resilience. And this may confuse somebody like why we are here today talking about healthcare. And the reason for that is that in 2022, during the COVID pandemics, we actually all could observe that the security and resilience is not only about tanks and drones, which are absolutely crucial, but if a healthcare system in a country fails, everything actually eventually collapses. And for this reason, we wanted to expand into healthcare to see what made some countries more successful than the rest at dealing with COVID-related issues. And while we're working on these first reports and papers, we realized that even though most countries had not yet recovered from COVID-related problems, they are soon to face another set of challenges associated with aging and rise in non-communicable diseases. The problem with these NCDs and aging is that unlike COVID, which unfortunately claimed lives within days, it is more subtle, it's more silent, it is invisible often to the eyes of decision makers and politicians, and for this reason it is often overlooked. So we know that there is a problem, but we just kind of don't care because it doesn't hurt today. And we at GlobSec, we perceive this as a massive potential security and resilience issue, and we wanted to create something that would enable us to remind the decision makers, politicians, the media, that if we want to be ready for these future challenges, we need to act now. And for this reason, we've created a very, very simple but effective tool, a ranking of countries, which is put in a very simple way, so everybody can, in a couple of moments, have a look at what is the performance of a healthcare system of the particular country, identify best practices, and spot maybe areas which could be improved. So we've called this initiative the Healthcare Readiness Index. The first one was published in 2022, so this is the 4th edition we currently have, which I'm about to present, and it was actually published just a couple of days ago. Before we turn to results, just a few words on methodology. So over the years, we've expanded it, we've changed it, we've received feedback from all international agencies, governments, stakeholder groups, and for the 2024 edition, we looked into more than 100 different indicators, out of which we selected 38. We grouped them into 2 parts. The first part is called Readiness Today, second Readiness Tomorrow, and I will explain later on why I'm mentioning it right now, especially because Latvia is really struggling with something we call Readiness Today, which is something like a starting position as to where we are today, whereas Readiness Tomorrow is about the factors which will shape future demand and supply, and Latvia is there slightly better when it comes to other countries. Then out of the 38 indicators, well, we take the 30 indicators, we measure them, we weight them, and we compose it into one number for every country, which can range from 0 to 100. So the higher a number a country has, the more ready it is to face future challenges. So it's very simple. If you think that you've seen something very similar to this, yes, in 2000 WHO published a report, it was called a World Health Report, and they did the rankings. However, after first year of edition, because of complaints of member states, which were donors to the WHO, they've cancelled the ranking. So we did something very similar, but with new data and more advanced methodology. So let's look at results, and I will start with the most ready countries. So out of the most ready countries, the first one was Sweden with the score of 73.2 points, followed by Netherlands, Denmark, Norway, and Germany. On the other hand, 9 out of 10 least performing countries were countries from the Central Eastern Europe, the only one exception being Greece. And I often present a lot about Greece because Greece is a nice warning what will happen if the country's governments do not address fiscal issues when it's still the time. Because after the financial crisis in Greece, they cut significantly funding to the healthcare. They had issues with demographics where more than 500,000 of young population of Greece left the country, which is the reason why they are in the least performing countries. When we look into the bottom of our ranking, we do not call it only the least performing countries, we call it also the countries with highest potential for improvement because it's more optimistic. So we have the Bulgaria, Romania, Poland, Slovakia, and on the 5th least ready, or the country with most potential for improvement, is Latvia with a score of 47.7 points. As you can see, when we look into the Readiness Today part, Latvia has the 3rd lowest score. Readiness Tomorrow, it is slightly better, it is the 6th. If you looked into the past publications, Latvia has been oscillating about this position, and now I will explain to you why do we believe that this is the case. So I will start with the primary drivers of the results in Readiness Today, which is actually where we are today, which is a consequence of past actions, past reforms which happened or didn't happen. And as you probably know, whatever health outcome we look, Latvia is unfortunately at the end of the rankings. This is the avoidable mortality with the latest data was still influenced by COVID in 2022. But even before COVID, Latvia has been always the highest or second highest when it comes to number of deaths that could be avoided if the healthcare system was more efficient. As I said, similar health outcomes could be observed or can be observed in across all indicators. You probably know it very well that Latvia has the lowest life expectancy across all EU in 2023. Also the highest gap between genders, which is also a massive issue, and significant differences between regions and the municipal part of the country. Moreover, in comparison to the rest of the EU or your neighboring countries, Latvia is one of the few countries which in 2023 has not yet recovered from the COVID pandemic, whereas some of your neighboring countries such as Lithuania actually even improved compared to 2019 by more than 1 year, which is actually very good rate of growth. There are several reasons why we are here today with these results. One of the most striking root cause of this issue is level of the financing, which I know there's been a great deal of debate in your country. If we look into the level of financing per capita, Latvia has the third lowest rate, roughly 1,966 euros per person in 2023. We have 2024 data, but not valid for all countries. That's the reason why I've used 2023 data. If you look into the left bit on the graph, it shows that out of the 5 highest spenders, 4 are countries which we call the best in class, which are dominating our index, such as Netherlands, Norway, or Germany. And the reason why these countries spend so much, even though in theory they might not have to spend so much, is they perceive healthcare expenditure as not as a cost, but as an investment that will return through exactly what your study was discussing, which is improved productivity, quality of life, longevity, eventually GDP and competitiveness of a country. It is basically simple as that. The first studies which proved it were published by IMF in 1990s, which was very clear, and I very much liked your barometer study, which actually proved it, and that's actually the case. You need to invest now to deliver later, and these countries are fully aware of it. There are a few points which I'd like to mention. It has to be acknowledged that that Latvia is the country which significantly increased its level of finances. If you look into this graph, it looks into the percentage growth over past 10 years, and you can see that if you compare past 10 years, the Latvia is the third fastest grower when it comes to the percentage growth in compared to the 10 years ago, with roughly 91% growth rate in comparison to the average of the CE of only 66%. It is significantly higher than your neighboring countries, such as Estonia or Lithuania. But what is a bit shame is that you abolished your reform in 2021, because as you can see the spike, it looked even more optimistic, unfortunately, than the reform of I'm not sure how you call it, the social health insurance contribution was abolished, but yet still it is very good rate of growth. But the problem is healthcare spending is a marathon, it is not a sprint. So you need 4 years to invest to see the results, unfortunately. Additional problems that we perceive is the structure of the amount of resources. Latvia has the second highest rate of out-of-pocket payments, which has its consequences, which I'll discuss soon. The highest level of out-of-pocket payments is Bulgaria. Bulgaria is a system where 16% of population does not have insurance, which is, I perceive, very unfortunate. And the third country is Greece, due to the financial issues which they still persist in the country to some extent. The consequences of the high level of out-of-pocket payments are obvious. If you look into Universal Health Coverage Index, which is an index done by World Bank, they looked into access to services on several scales. The Latvia is the second worst in this index. Latvia has 5 highest rate of unmet medical needs. So all of these indicators pointing out that there are issues with access, especially when it comes to specific socioeconomic groups and regions. There were particularly big differences, right? The major problem that we've identified is something that you know very well, which is lack of resources. And if you plot number of nurses and doctors on this graph, you can spot that Latvia is the purple dot on the left bottom. So it actually, from this perspective, it has probably the highest problems out of all EU countries when it comes to the human resources. We are fully aware that you've tried to solve it through wage increases. We can discuss it later on, because several countries has been trying to do it, especially during the COVID. They've introduced legislation that enables workers in healthcare to have right for a specific multiple of average wage in industries, or several decrees that significantly increase the average wage, although not always it worked, because usually surrounding countries do the same and eventually it has no impact. This is a big problem that is very difficult to be solved, especially for smaller countries such as Latvia or Slovakia, which always will struggle with bigger and more powerful neighboring countries, or Germany or Netherlands or Norway, etc. Right. On the other hand, there are some positives. Latvia has the third highest ratio of number of cities and MRIs per inhabitants. Also, when it comes to number of tests, which is positive. I believe that you will be able to explain it more better why this is the case. But it is usually found among the most performing countries, not the least performing countries. And this is up to discussion and argument, but if you look into this graph, I'm not sure if you have seen this, this is what happens when you plot percentage allocation of resilience recovery plan and the overall GDP proportion on the resilience plan. You can see that Latvia invested on healthcare above average resources in comparison to other states, which to some extent clearly illustrates that the government believes that healthcare is important. In fact, I think it has the 9th position when it comes to like the highest proportion to lowest, so it's fairly good. Moving on to the readiness tomorrow, the best-in-class countries definitely don't only invest large amounts, they invest structural. They usually invest in something that delivers long-term value, such as the prevention. And as you can see on the left, this graph shows the spending on prevention per capita. Out of the 5 highest spender, 4 are countries from best-in-class box. Unfortunately, Latvia is 3rd lowest spender, where you spend per person per day less than the price of an apple on prevention, which is just not well sufficient. The reason why the countries on the left spend so much is, well, because they invest now so they can save later on. It is, well, very, very simple. Unfortunately, the best-in-class countries also invest heavily into all determinants of health. Latvia, this is, from my perspective, when it comes to the future outlook of the country, the biggest challenge, because in basically all critical determinants of health, Latvia is not doing so well. It has it has the worst consumption of alcohol. It has the lowest consumption of fruits. It has the 4th largest obesity rates and 3rd largest smoking rates. I know that these data are collected through EU Silk and Eurostat. They have it specific. Not always they are like 100% correct, but the trends also unfortunately illustrate that the Latvia is not only among the worst when it comes to these critical determinants of health in the future, but in many of them is actually worsening. For example, if you look into change in alcohol consumption of past 10 years, Latvia is one of the few countries whose alcohol consumption is actually increasing, including smoking, especially when it comes to using novelty products for children and teenagers. Despite all these negatives, there is one huge positive which can be turned into an opportunity. I'm not sure if you have seen this graph. This is one of my favorite graphs, which is taken from and compiled from the aging report, which is done by EU Commission, which shows what is expected percentage change on what is expected change in share of health expenditure as a GDP in future because of aging. So it says, for example, that within 50 or 40 or 30 years, we can expect a 40 or 30% increase in health expenditure because of aging. This is basically what EU Commission does. But what they did 2 scenarios. The first scenario is they called it healthy aging scenario, and they did another scenario called no healthy aging. And as you can see on the Latvia, it has an opportunity that if it improved its determinants of health, it is actually the country which can reduce its proportion on spending as a share of GDP by 11% in the future. So the overall amount will be higher because it grows, but as a proportion of the GDP, it will decrease if you manage the determinants of health well. And this is amazing opportunity because if you look, for example, at Poland or Slovakia or most large countries, whatever they do, they will always increase it because they can't manage it well. But in your case, also considering your situation today, you have opportunity to decrease proportion of resources. That's amazing if you, of course, succeed. Last factor I would like to mention is relating to probably your favorite topic, which is the best-in-class countries tend to embrace innovations, basically. This is something difficult to measure, but there are proxy indicators, such as FPS, rate of availability, and time to availability of medicines. And you probably know that Latvia has been struggling with this indicator, especially due to the financial constraints that we discussed. On the other hand, a slight positive is that the medicines that manage to get reimbursed, they enter the market on average comparable terms as the rest of the CE countries. So still it is more than 600 days, but it is significantly better than, for example, Poland or Slovakia. Unfortunately, it is still several multiples of Germans' 100-something days or Denmark's 400 days. Yet this illustrates that, once again, fiscal issues are the key obstacle to the access to innovations rather than the processes itself. This is my last factor, which I don't know how to categorize, but it's very important indicator that we use. In most cases, the highest predictor of overall outcome of the readiness index is something we call leadership stability, which can be measured as average tenure of ministers. So how many days or months a minister stays in his or her office. And as you can see on the left, the graph shows the darker the color, the longer a minister stays in his or her office. And on the right, I've just selected some countries, including Latvia, averages, and some of the countries which are the best in class in our case. And as you can see, there are significant differences in the countries and also in the results. As you can see on the following slide, you can see nice visual correlation between the average tenure and overall readiness index. And the reason for this is very simple. If you change minister every, well, 1.7 years, it's very difficult to focus on long-term projects, on reforms. It's very difficult to do something other than put up fires which are right now, which leads to short-term transactional relationship and not the value building that Nordic countries and the countries who have ministers for years can actually deliver. And this is something we can't influence, but is very, very, very important because instability leads to stagnation, continuity to progression. This is unfortunately the fact. So just to conclude, I know that several of these pieces of information are skewed by the data availability. For example, regarding the financing, we know that some countries, including Slovakia, has been using the resources from Ministry of Defense to construct hospitals because even in other countries it is seen as a quality of healthcare infrastructure is seen as a potential security risks. So this is not fully reflected on this diagram, but yet we believe that it nicely shows that the countries which are at the bottom of our indicator really needs to improve its readiness because, as your study confirmed it, if you invest into healthcare, it will deliver with interest. And also, as a part of the union, a chain is as strong as its weakest link, and unless we decrease the differences between top performance and least performance, we will never be able to defend ourselves and compete against the rest of the world. Most of us don't actually remember it anyway, but the health insurance system, the way it works in our countries, was actually established to ensure that we have healthy populations so they can work and they can defend in the situation. And unfortunately, both of these cases are very valid. My last words is that we are fully aware at GlobSec that priorities have shifted elsewhere. The war in Ukraine must be the top priority, but now it is time to build a resilient healthcare system because when the situation comes in the future, whether it is war-related or aging-related, unless we build the healthcare system now, later will be unfortunately late, and we will suffer the same as we did during the COVID pandemic. And this is what we try to do at GlobSec, to remind important people that we know the situation is tough, we know that there are no finances, but now it is time to build the future.
Well, thank you. Excellent, Martin. Your overview, where we are in the context, also comparing us to other countries' important elements, and I'm sure that we will discuss during the panel discussion. Before I continue, just a quick reminder to our online viewers that you have a possibility also to join in the discussion by asking the questions in the Slido application. You can use, or you can scan the QR code, or just go to slido.com and hashtag readiness and ask the question. We will definitely bring it up. But before we move with other, you were mentioning, and you know, here in the Baltic states, when it comes to security, we are on the same page when it comes to the Baltic sisters. But we like to compare each of us. And sometimes when we're speaking about, especially about health, there is trend that, you know, something is better in Lithuania or something is better in Estonia. Taking into account the readiness today and especially readiness tomorrow, do you see the difference between the policies when it comes to Latvia, Lithuania, and Estonia? Because the starting point for all of us, as we saying, was the same. We regained our independence. We're starting from the scratch, actually, building our own systems, and it goes also for the health. Do you see differences and also something that we can take from our sisters, Lithuania and Estonia as well?
That's actually a good question. That's the reason why I've clicked back to the slide, so you can see that you see Latvia, Lithuania are very close to each other. Estonia is slightly better when it comes to results, but slightly. But as you said, you can very clearly see the common background. We have the very similar situation when it comes to Slovakia and Czech Republic, because we used to be Czechoslovakia, and yet if you see the results, Slovakia is 4th, least ready, and Czechia is actually among the best when it comes to CE region, which once again clearly demonstrates that there were differences when it comes to some approaches to health policy. The largest difference I've observed so far was actually, especially when it comes to Estonia, and the level of financing, which has been higher, and that it is so simple, but there is no shortcut when it comes to level of financing. There is no shortcut how to overtake it, how to make it different. Unless you invest, you won't see results. And in Estonia, for years they've been investing more, and they now see more result than you. And regarding the rest of the policies, I mean, if you, for example, look into the first and second best countries, Sweden and Netherlands, they are completely different. I mean, the Netherlands has a system of competing health insurance companies. Sweden or Norway, there later on other countries with centralized healthcare systems, completely different. Yet they share common traits. They invest a lot. They focus on prevention. They build on their human resources, and they are trying to keep the continuity in the reforms. This is what makes countries more successful than the rest. In many cases, the individual differences, whether, for example, you have hospitals which are governed by one state entity or they are private, they do not play as much role as these large-scale macro let's say, decisions. And unfortunately, without financing, you can't improve as much.
And that's something that we, the main narrative in our health economics barometer that you mentioned, that we also presented a couple of weeks ago, was that we are missing 1 billion each year annually, comparing our GDP to the average of EU. So it's every year you are missing 1 billion in health system. And definitely taking into account back to what you said, that health is incorporate element of defense or security, definitely we have to take it also in combination. Ministry of Health, taking into account what you heard, do you agree? That was my first question. And second, after, I don't know, 2014, 2022, do we also can say that the resilience as the concept has come into also the health sector as well? Has it changed, and how it changed?
Yes. First of all, thank you for the report and all the previous reports. And yes, we do agree. I personally agree, and it states all the details quite perfectly. Regarding resilience and where we were and where we are now, yes, we have changed, and not only started from 2022, but from 2020, when the COVID hit the pandemics throughout the world. It was one of major crises we all experienced. So it made the shift of perception, how we have to rebuild our resilience of the system. What I might say today, when the war started in the Ukraine, when the invasion, full-scale invasion was in 2022, we still reshifting our preparedness because, of course, until that, we weren't focusing so much on possible invasion. Of course, we were preparing ourselves for such crises like pandemics or climate changes. We, from time to time in Latvia, we have some big storms, electricity shortcuts, and so on. We weren't so much, of course, thinking of these kind of crises. And yes, of course, we are building our resilience in this regard. What is precisely mentioned in one of the reports, I'm now mixing in which of the reports, but in one of the reports it's very precisely mentioned that, of course, you cannot build something that had to be built for decades. So it takes time. And the most important is this understanding of the policymakers and those in the parliament who decide on the priorities where we spend our investments. that these investments should be done. And what you showed about this curve after the COVID, and that is dropped, it was one, from the Ministry of Health point of view, it was one of our mistakes. I dare to say it was a mistake, that the investment, money-wise investment in the system was only due to COVID. It wasn't like permanent and staying there. Otherwise, we would be, I'm sure, in completely different position today. Just to say some things more, if, for example, today somebody would come and give us 1 billion euro in addition, it wouldn't help as well, because the system has to be ready to take the financing and to be ready to accumulate it and to use it where it's needed. I can only agree with what you've said about behavioral determinants. It's where we have spent too less. But again, there is the reason why, because we have these, not fireworks, but fires which we have to put down in inpatient sector. So it's all like vicious circle we have to deal with. Did I answer your question?
Yes. First of all, I was glad to hear that you agree with the both reports that we have made, one from Globsec and another from Powerhouse Latvia. If I may, immediately a follow-up question. I really enjoyed the concept resilience today and resilience tomorrow. What are you preparing for? What kind of crisis? Of course, there are couple of crises, and you already mentioned there have been a COVID, there have been a military, there have been, and the next one is something that we are not can even imagine, right? But readiness and resilience tomorrow. What would you say? What is the top three which you are preparing for when it comes from the health? From the perspective also, what is the missing points?
I'm not sure I would dare to mention three most important, but one that comes into my mind at once, also going through the reports, is the trust of the society and preparedness of the society. Another thing is agility of the system. These are the things we have to very much focus, and we sometimes neglect. Because of course we very much focus when we speak of the investment of financing, where we put that in the system, whether it's inpatient, whether it's medicines, whether it's, I don't know, prevention, but then we lack, and it was very good chart about trust of the society into the system. Because when the crisis hit, and the shocking chart for me was what society thinks of the COVID. And this is what we have to work very much. That is point one. Point second, as good as we would think about ourselves that we can predict future, we cannot. So the only thing what we can do is train our agility to be prepared for whatever comes.
Well, perfect. And we also saw that this correlation between actually out-of-pocket payments, the second in the European Union, from the negative side, meaning that we are the ones that we are paying more out-of-pocket comparing to any other European Union state. But this correlation between the trust, efficiency, and how much you individually invest, and you are also expecting some things from the sector. Thank you very much. Minister of Defense. And here, well, in 2016, there was a new state defense concept. And I recall there was a huge debate on the new term at that time, comprehensive state defense. And coming to the health, how from the Ministry of Defense perspective, how do you perceive the health sector? What you are expecting from the health in times of crisis, and also in times that we are right now? Someone would argue that we are already in a hybrid warfare.
Thanks for a very interesting report and very interesting this project. It was, I think, it will be very useful for everybody in Latvia, but not only in Latvia, because there is very huge this amount of information about countries, and it's very good for job in the next projects and in next meetings. But if I come back to your question, yes, we have comprehensive state defense system in Latvia, and the health sector is one of the most important sectors. All the sectors are very important, but health sector is very important for us, because we have requirements for national resilience, and there are 7 requirements: continuity of government, energy supplies, and controlled movement of people, food and water resource, and ability to deal with mass casualties in disruptive health crisis. And this point is the main point where we're working with the Ministry of Health. I know that Ministry of Health have a state emergency medical plan. We have worked together with Annex for civil military cooperation, and we have worked together with on other political planning documents and plans. We have lot of exercises. Every year we have a lot of exercises together with Ministry of Health. But I understand that we need to train again our personnel, because one thing is theoretical plans, and it's very good that we have such a plans, because planning process is very useful for all the sectors. You see other sectors resource, you can see other sector resource, and you have list with counter partners, and you can work with them. But training, I think, not only at state level, or not only in ministerial level between Ministry of Health and Ministry of Defense, but it's very important to start these trainings in all the health facilities, because it's very important to understand that every health facility need to be ready for these threats. And I know that health facilities have disaster medical plans, and they training, but maybe not all health facilities, and not every year. I hope that from this theoretical part we will go more to this practical part. And it's true that this is not sprint, this is marathon.
Well, indeed. This is marathon, and coming back to somehow the elephant in the room, about the financing, Birut, if I may, the question to you. I understand that you are in the hot spot right now, and you are not a politician. But do you see merging or giving also responsibility more to the Ministry of the Health, but also with the financing, meaning some of the services that is needed for this comprehensive state defense that could be devoted to Ministry of Health, and therefore increasing also the budget that was meant for the security. Are there any discussions among civil servants, highest level, or politicians that you can share on this regard? Because I'm sure there have been, right, Martin, there have been a couple of ways how countries have dealt with that.
Yes, I'm not politician. And I will not promise something, but from my point of perspective, I agree that preparedness need money, because without money you can't buy or purchase these stockpiles, and you can't build up capacities. This discussion, last week I was in Brussels, and there was the same discussion between civilian sector and military sector about budget, about financing, about sources of financing. I hope that they will find solutions in this level, but we need to look for solutions at the national level too.
Yes, please, Agnese.
If I may add to this, well, there is discussion on all the levels. Also in NATO, we know this percentage division. But my point of, I'm also not politician, I'm civil servant. But my point of view is and believe that it is not fair to ask whether you Ministry of Health is ready to support Ministry of Defense and vice versa. It is the state's responsibility to invest in this state's resilience. It's not the question about whether we Ministry of Health and healthcare system will be resilient. It's about society. So it's the question to the government and not to the ministries.
Yeah, fully agree.
I agree that there is not competition between ministries. This is state level decision and state level solutions.
But at the end, you are required to provide services that are meant also for increasing our security. Going to facilities, or how it was classified, and going and looking from the hospital perspective, hospitals have been stress tested as far as also publicly available information. You've been part also of any kind of military drills, NAMEs or whatsoever, and understanding what could be your role. What would you say? What is the resilience of your particular hospital, and also when it comes to the wider perspective, not you, but also the hospitals in Latvia, and what is the missing part from you as a chairman? What would be your message to civil servants and politicians as well?
First of all, thank you so much, and it's truly a pleasure to be part of the discussion, and thank you, Martin, for the report. It's very insightful. And I believe actually that the readiness index highlighted something that we all intuitively knew, that healthcare is no longer a theoretical concept, or resilience of healthcare is not only in theory, but actually it's a practical national security requirement. And that's why I think we are working together also very closely with the Ministry of Defense, and also with municipality and other kind of involved parties to strengthen our ability to be ready in certain cases. But in terms of your question, if I think we are ready, I think we are never going to be 100% ready, but we are getting there, and that's why we have these drills together with NATO forces, with local national forces, together with other clinics and specialty clinics. We are getting there. We have still a lot to do, but I think we have a good team in place in our hospital and also at the national level. And we are learning. We are still learning. I know we have a lot of gaps that we need to fulfill, but we'll get there. And hopefully there will be no day when we will need to use those skills. And hopefully that will stay at the training level. But at one point, so we have been training since last year, or since I am a chairman, there have been drills going on. And at one point, my colleagues asked me, "Hey, Loris, like, we are tired of training, so could we just get a break?" But I think till we have that threat, we have to be training. We have to be ready and show other forces that we are not going to rest till they come down.
Within the concept of readiness tomorrow, the same kind of question. Top three for you, when you see that, yeah, here are still missing elements, and we are, from the hospital perspective, we are coming and contributing to that.
Some of the elements I wouldn't want to speak about publicly. They're highly sensitive, and we know those. That's our homework, and we are currently working on them. But I think one thing we can definitely improve is kind of multi-institutional conversation, connection, and kind of maybe communication. Yeah, communication could be much better at some point. Also with the local government, municipality.
Thank you. Thank you, Lauris. Vladislava, medicals, innovation also contributes, as mentioned and highlighted also by Martin, that leads to, at the end of the day, it leads to also the readiness, resilience. From your perspective, how you understand what is the resilience, and what are the missing parts here in Latvia?
Yes, also from my side, thank you very much for the very insightful report. And I think when we look at the resilience in general, it's a very multi-layered concept. And again, as we see in this report, when we talk about health resilience, it's also very multi-layered. And of course, it's important to invest in preparedness for mass casualty, also to have medicine reserves, but we also need to have a capable healthcare system as such. And I think when we look back at COVID, there we saw, and we also see here in the report, that we had to invest a lot during COVID times, much more than other countries, but it was precisely because our healthcare system was not ready. We had many gaps, and every gap that we maybe don't feel that much in our everyday life, when crises come, then we feel every problem in the system. And then we had to do these massive investments, and we also had to implement much more aggressive policies than other countries. For example, in terms of movement of people, we had to stay at home much more than other countries. Also vaccination levels, that also in this report we see that we are not so bad comparing to other countries, but it is because part of it was not voluntary. People had to go and get vaccine to go to work in some cases. So because we were not ready, we had to spend much more than other countries. So now when we look into the future, I think this is the biggest learning that we can take, that we do have to invest now in case a crisis comes, that we are ready. Talking about medicines, and again looking at the report, of course it's very striking to see us at one of the last places in terms of access of medicines to patients in Latvia. When we all know, and I think that decision makers and everyone knows, that it is a cost-effective way for treatment. It brings value not only to patients but also to the economy. And also when we talk about crisis, medicines is something when in many cases you can use at home, you can get treated at home, and maybe then hospitals and emergency services can deal with other problems while as many patients as possible would be treated at home. So I think also looking at the budget for next year, unfortunately, we do not see increase for medicines. That would be very important. And then coming to trust issues that was mentioned, trust of society to the government, we had our own survey also together with Powerhouse this autumn, when we asked people what do they think, what is the biggest priority for next year? Because obviously for government, and I think we all understand that defense and security is where money should go. But when we look at what people think that health is first priority, then it's economy and the growth, and only third place is defense and security. Probably we would want all people to come together and be strong societies that understand that defense is most important. But in order to achieve that, we have to invest in health first, so that people's most basic unmet needs in health sector are dealt with, and only then, we can build more strengthy society and communities.
Oh, perfect. Thank you. Martin, hearing all of that, I'm sure that you have already the body language was, I have the solution For that, I heard something, somehow commenting also, but with the question, is there any, you heard also some vulnerabilities, gaps, what we have identified. Is there any pilot projects or international best practice that you can say, yeah, look at that from, I don't know, hospital perspective, how the connection between Ministry of Health and Ministry of Defense has been in some countries? Is there any that you can share that could facilitate also the resilience of the whole country?
Yes, I believe so. Firstly, what I would like to mention is that I was looking forward to being here today because when you, I expected it, and it actually happened, is that in many cases you come to countries where you feel the emotion that people want the situation to get better, and this is from your answers. It's apparent that you know that there is an issue, you want to improve it, you want to solve it, and you would be surprised to see that this is not always the case, but I knew it all from the media that this is the case in Latvia, so I'm happy to be here as well. So the first point I forgot to mention. As the second point is I really love the interaction between the Ministry of Defense providers and the Ministry of Health, and I know that Slovakia is not a good, often used as a good example in many cases, but there is one case which I like a lot. I'm also involved in the project as we discuss it, and it is that the Ministry of Defense in most cases, in most countries, has its own separate budget. There are some NATO requirements to spend more or less 2% of GDP, etc. Not always the countries can fulfill it because if you buy fighter jets, it takes years to come, then the payments, etc. So it's not always able to fulfill the percentage. What happened in Slovakia was that they've combined this, that in some years we knew that we will not be able to spend the 2% because of some late installments, etc. We've combined the fact that Ministry of Defense does not have to have all the permits where it wants to construct build because it's the Ministry of Defense, and it does not have to do the public procurement as other providers because it has some shortcuts. And this was combined, and Ministry of Defense actually took over one large hospital in east part of Slovakia close to Ukraine border from the Ministry of Health, basically took over. It was in debt, it paid the debts, and it started to build a new hospital, large one, including the military base and everything, funded by the Ministry of Defense. The project started a year and a half ago. Expected opening date is within 18 months. Extremely quick, co-funded by EU Investment Bank, and well, it will serve civilians in times of peace, but in the case of a issue, problem, a military conflict or another round of, COVID or whatever infection, it can reprofile, expand its capacities, and fulfill this resilience also issue. And also the military Ministry of Defense then participates still on the project in capital, where it's building the largest hospital in Slovakia with the Ministry of Health. So they've created a combined organization, Health Ministry of Defense, Health Ministry of Health. Defense is utilizing the opportunity that they can start digging and building right away. Ministry of Health is responsible for the medical bits, and it works nicely. And also Ministry of Defense is directly subsidizing these hospitals to cover for extra services they have. So it's a nice cooperation of how it can work, and it was also praised at the level of NATO and EU.
Perfect. Thank you for example. And this is actually one of the questions that is from our online viewers. I suppose it's for the chairman of the hospital. How to ensure, are our hospitals currently capable of handling a sudden surge in patients during a geopolitical or public health crisis? If not, what is the biggest bottleneck? How you would describe such a situation? Because we have heard also publicly that the percentage of available beds are close to 100. I mean, in some of the periods during autumn, right, when there is some kind of infection going on in the city. So how you would describe the situation, and is there any preparedness for that? How to deal with that?
Of course, we have certain protocols, right? If there's a disaster, or it depends, right? Pandemic is something different than cyber attack or military disaster. But we played out a scenario where, in short amount of time, we had to kind of take in 100 patients. We were able to transform our hospital within like 2 hours into a military hospital, so which basically works. But again, this was a training, right? We had all personnel come in and present, but God forbid, if that's a real war, most likely we'll be short of staff. So that's something that we didn't account for, and I think in a future kind of scenarios, we will need to do that as well, account for maybe 40% of staff that would come in only, right? And then see how it plays out, because with all available staff, we can do it, and we proved it that if we can do it, we did everything what we were planning to do. But in terms of kind of surge today or tomorrow, like I said, there is a protocol. We would send home or we would discharge certain patients with certain criteria that could walk home. They would be discharged, and we would free up a couple hundred beds at our hospital within a short amount of time.
And you have a special role in times of crisis, right? So Ministry of Defense is expecting that you will provide additional assistance to the military medicine, I suppose.
Yeah, so in that case, we would be in close coordination with the military folks. Yes.
I think there is a couple of broader questions, and I'm looking at the Ministry of Health. How do you ensure that patients' rights and access to care are protected in crisis conditions when resources become constrained? Well, this is the question, philosophical a bit. Where's the red line? Is there any? And coming also, if we are reaching those limits, how we deal with that?
Well, there was mentioned protocol for the hospital. There are protocols, if I may put it that way, also for different kind of crisis. Again, like my colleague Biruta from Ministry of Defense said, there are plans, and our task is to train those plans so they would be by heart. But there are protocols, and there are different lines for different cases and scenarios, and different. Vladislava mentioned mass casualties, but there are also a lot of like pandemics. It was, and during pandemics, we can look back. All of us can look back, whether we were working in the system of health or we were all in pandemics, and there were protocols switched on, unfortunately. And we have to be prepared that at some point, if God forbid something happens, there might be switched on protocols where some patients will be discharged. So the most needed would be taken into. Of course, yes, there are protocols.
Okay. To NATO question. Debates at NATO level. Is there some kind of trend going on? The new resilience concept. When NATO is speaking about resilience, what do they mean, and what is the role of health at the organizational level?
At the organizational level, they see health sector as one of the very important sectors. And there is a lot of issue how to build up health sector's capacities in all the countries, because shortage of health staff, for example, shortage of health workers, there is problem in all the countries, not only in Latvia. Maybe in Latvia we don't have nurses. Ours is average number is lower than in other countries, but problem with health workers are everywhere. And we need to work together, all the countries, all the NATO countries, on legislation, on ideas how to deal with this workforce shortage. What we will do with blood and medicine chains, logistic chains in health time, in a crisis time, because it's a very hard issue. It's not so easy to solve in one country at national level, but if you need to standardize in more countries, it's a very huge and very complex issue.
Mm-hmm. I think it's more for Vladislava. From the industry's perspective, what is the single biggest barrier preventing Latvia from being more resilient in terms of medicine available? Is it only about the money? Of course, money matters, right? But
yes, I think money in this case really matters a lot, because when we look at the different kind of criteria, we are quite, of course, we are a small country, but still manufacturers are coming, and there are medicines that would be ready to be available to patients, and they are actually also undergoing process that we have in the medicines agency, and they say yes, these medicines are cost effective and you can use them here in Latvia, and then these medicines just come into queue, and usually we have around 80 to 100 different kind of medicines in the queue just waiting for finances. So it is a major problem. When we look at how fast, for example, medicines agency work and so on, we are actually quite, comparing to other countries, we are quite fine. So this queue of medicines that are waiting to be available is just, you know, waiting for money. So I would say it is the biggest problem.
And I think here is a follow-up. Also, you probably know the situation. If there is the case that we are, I don't know, blocked from the mainland of NATO, and we don't have like available coming in medicine, how long can we stand? Is there any list? I'm sure that Agnes also will contribute to that. Is there a list? Is the association involved in this process? Involved? Would you ask for something more in this regard?
Well, I know that ministry is working, and also EU has a list, but also in Latvia we have a list. And I think when we talk about stockpiling and being ready for crisis, first we also have to coordinate on the EU level so that all the stockpiles are coordinated in a way that it's enough for everyone that needs, but also that it doesn't disrupt the market. So, for example, if some bigger countries would do a huge stockpile, it would also impact the access even without having crisis in other countries. But I think there are different kind of levels. Of course, also it's individual level, so that people who have some chronic disease, they do have to think about what kind of reserves they have at home, and they need to have also each of us, even if we are like doesn't have any illnesses now, we need to have medicines in specific categories like pain relief and so on. And then of course it's state level, it's hospital level, emergency services level, and then the higher level that is for people, and ministry I think is working, and we have been consulting with the ministry as well. But I think that the EU coordination is very important because pharmaceuticals market is very, very global, and in any case we will need coordination with other countries.
How many days?
Months.
Months.
We are preparing ourselves for months.
Months.
Yes. It's well. This is a very good example, particularly on cooperation between two ministries. Although I said it shouldn't be directed to the ministry, that Ministry of Defense found some millions for us so not for us, for the society. So we would procure another layer of reserves for the society. So
it's agreed now.
It is
in this budget.
In for the next year, yes, yep. For the next and consecutive 3 years in total. So it is good, but it's not the only reserve we are making. There always has been state material reserves, yes, which is managed by our state medicine agency, if I said correctly, emergency medical agency. And like I said recently, I would never thought that I would say thanks to COVID, but thanks to COVID, we have around 2-3 months reserves of medicines in each hospital of Latvia. Mm-hmm. Because during the COVID, the government found the financing to invest, so they would procure these resources, and they are keeping them. So we are quite fit already now, but we will be more, we are working.
Great to hear that. Martin, I think it's more related to you. One of the viewers are asking, what technologies, AI, data systems, predictive analytics could meaningfully improve crisis readiness in the next 5 years? Have you witnessed in your report something like that? How the technologies, and particularly maybe artificial intelligence, contributing to the resilience of the health sector?
I mean, for this version of publication, for the first time we've introduced some data-based AI / not AI yet, but data-based digital indicators, because thanks to European Health Data Space, finally there are some data which can be used to compare how digitalized healthcare systems are across the member states. So we have got 2 or 3 indicators in the index this year. Regarding the AI, I'm a huge fan of AI. I'm also helped set up several startups in healthcare AI, so I truly believe in it. But there is few but. The first but is that over short to medium period of time, it's unlikely that AI will help to solve the HR crisis, because several reasons. First reason is there's still not sufficient amount of AI tools which would be approved according to the Medical Devices Act, so we can't still use them. Secondly, they still require training, and they require in many cases existing digital infrastructure, which often in usually hospitals and outpatient clinics is not sufficient. So even though the tool would be available, we won't be able to use it. And third point is that it will require in many cases, retraining of personnel. Average age of a nurse or doctor is in most CE countries more than 50, which seems to be a problem in several countries. For example, in the UK, they've already developed, they have I will translate it something like a national education agency which develops the guidelines for nurses and doctors, etc. And they've stated there that they believe that, for example, all pharmacists should be trained in AI, so in 5, 6, 7, 10 years time they are ready. So the Western countries are changing their curriculum. They are trying to train the new staff so they are ready, but in couple of years time I don't expect massive changes, maybe 5 more, yes, but we need it to be categorized so we know it's safe, and we need to have retrained personnel and also existing digital infrastructure so we can build on it. But if you're looking in some success cases, there are several small startups all around Europe which are automating EKG, the readings, the automatic readings from CTs, MRI scans. This is already working, but like large scale, that it will help to automate processes. It will still require some time, but then it will deliver massive value for sure.
Very good, and I think in your example, the private-public partnership that could also contribute could be solution that there are already available solutions that could be available for the government.
Yes, and this is exactly what we can call it smaller countries such as Latvia, Slovakia can be very good at, is because we can become a sandbox for these AI tools, because it's much easier for us to implement something than in Germany. And I've seen very nice success cases in our region just because of this, that we are small, we can talk to each other, we know each other, we can make things happen fast and then roll out to other countries.
The beauty of small,
yes,
small countries in brackets. Agnes.
I just wanted to add, having said what Martin just said, I think all of you would agree that this is nevertheless the way we have to go forward. Not only AI, but in innovative technologies, innovative processes. Because when we have a little bit mentioned HR problem, but the problem is there and it will not go away. And we will not invent a lot of people, and Latvian is quite hard language to learn, so invent a lot of doctors or import them here. So we have to be innovative, and this is one of the big challenges which we understand the system. We have to work, we have to be innovative in how we provide service. We have to teach medical doctors and medical professionals in using the technologies, but we also have to teach society to trust to new ways how the service is provided. There is no other way to go forward.
Doris, you wanted to mention something?
I think just a little bit on digital tools that we are also implemented together with industry partners around education and kind of health literacy. I think that's another thing that we need to focus on in order to reduce maybe these lifestyle diseases which are incurred through maybe overuse of alcohol or smoking or unhealthy eating and maybe not moving enough and not sleeping enough. So we need to work also with the society to reduce that pressure on healthcare that's currently right now, and we are doing it through digital tools, like very simple health assessment that could be done through your phone or through your computer. That's one thing, and also kind of in order to help our radiology or diagnostic radiology folks, we have also created some digital tools that help with the diagnostics, faster, more accurate readings. It's funny, slide that you showed about a CT X-ray ratio per 1,000 inhabitants. I think that's a good ratio, I guess, for Latvia, but I think in the caveat to that, I think sales reps are working better maybe here than elsewhere, because we have a shortage of radiologists and radiographers at our hospital. So I believe that in other institutions also these machines are sitting idle, unfortunately, and that's just a waste of money.
Well, perfect. We are coming to the concluding part. And if I may, let's imagine that we are here sitting maybe in the same room, 2030. And I really like this concept, resilience tomorrow. In 5 years, what would be your 3 main activities that we have accomplished here in Latvia that could increase the level of resilience? It could be very small or very big, up to you. And if I may, Martin, give us some thoughts, some ideas, and can we start with you?
So, me personally, I would love to see in 5 years' time, I would focus on the determinants of health, and I would love to see that you won't be able to buy a nicotine product in the country. Any form, which is extremely strict. I know it's extremely ambitious, but it's possible. Lithuania is a very nice example of, for example, what they did when it comes to alcohol. They had like very strict, and then like they changed the legislation, but it proved to see that it's possible even in this region that we know that tends to enjoy good things, you know. So this is at least one thing I would like to see, and the second thing is that the level of finances I would love to see too. I don't expect it to reach the average of the EU, but at least the average of the CE, for sure. These two things together would significantly improve what will happen in then 10 and 15 years later on.
Oh, perfect, thank you. Lato?
Yes, I will also start with financing, and I will say that we have to, I would be more ambitious. I think we would have to reach EU average at least. And also, but not only, well, also for health system as such. And I believe if we will increase finances, we will also reach much better healthcare outcomes, but also for healthcare preparedness levels, because the latest OECD report actually showed that Latvia, together with Costa Rica and Mexico, are the countries who spend the less for preparedness. And even though I see that ministry is working, you still have to you need money for that as well. So I would start with that. And when we have this money, of course, as a report showed, we have to spend it for prevention, both primary prevention and also secondary prevention, also health literacy, and medicines, and cost-effective ways that we invest that in long term, we will have these investments back. That would be my 2 points.
Perfect, thank you.
Yes, I will start what I would like to see at our hospital. So finished the new building that we are currently working on, and it's quite overdue due to some reasons. That's the first thing. So we will have a new proper facility in order to help our people and Latvian people in the case of need. That's first thing. And the second part, of course, is proper financing, because that is something we are currently lacking, and we have talked a lot about it, and probably I'm not going to repeat all of that. And then the workforce. So I would love to see nurse-physician ratio that we saw earlier, maybe a little better than we are currently at. We are currently at the bottom. And we are hoping to attract and retain more nurses for our hospital.
Perfect. Yes. From the Ministry of Defense perspective, how do you perceive?
We will continue our collaboration with the Ministry of Health, of course. We will work on disaster medicine plans together, on procedures, and 3 things, if I want to say 3 things: training, training, and training. Together with Ministry of Health and together with hospitals, this practical part, training and knowledge for personnel.
Good, thank you.
So I sign myself to all mentioned, first of all. If we are sitting in 5 years' time here together, then one thing, we are sitting together also with the Ministry of Finance and member of the Parliament from Budgetary Committee. Please write it down. We have achieved to adopt amendments to the law on tobacco and alcohol. Well, not restrict, but at least to go for plain packaging. I think it's good thing. And alcohol, yes, almost invisible for especially youngsters. And like I said, communicate. This is our task: is communicating with the society to assure them that the system is working and preparing itself. Also raising awareness what society has to do itself to be prepared. And from a little bit part of wishful thinking, in 5 years' time, yes, in 5 years' time, we are working all together and not sometimes separately. Yes.
Laszlo, you wanted something?
Yes, I would like to add, but well, looking at listening to other wishes and looking like 5 years time. And I think that to achieve it, we actually have to start today. Also, we should never get tired of asking and showing the different kind of indexes and researches and asking for finances that we need for our health system. And we should not normalize the underfunded system we have now. It's not normal, and we are in a crisis, actually. So I think we should work with that every day, until in 5 years we are EU average.
Exactly, and we are not also normalizing the concept of the resilience, right? The buzzword or the elephant in the room. And I think that what we did in the last hour and quarter is that we indicated. You started with 100 indicators. There are a couple of, I'm mentioning what you mentioned here: financing, innovation, prevention, new building. Also, right? All of that matters. And I think each of that activity, if we are taking that, we are investing in that, that leads what you said, to increase the level of credibility of the government and also of health sector. What our opponent is willing to do is to make that we are the failed state. And this is something that all of those activities, also new building, increase this, that we are investing, we are ready, and we will be ready to defend. And health is one in the front line of that, right? So thank you very much, colleagues, for your time. Work continue, and see you in 5 years in a bit wider panel discussion. Thank you. And thank you online viewers who also contributed to the questions. Thank you.